Second, just want to get started here. We're going to talk about Antidote and their individual plans. Antidote is a new kid on the block. This is their third year in the Ohio market, or 2026 will be the third year in the Ohio market. They entered the market in 2024 as an off exchange offering, and then last year they were on and off exchange and made a big splash. And they're tremendous. And Jason will be talking more about that in a second. You know the drill. If you got a question, you'll put that in the question box. And not only will I get that at the end of the presentation, I'm going to monitor these throughout the presentation. I'll jump in at various moments. Okay. And I'm going to let somebody in if you don't mind. I need to let somebody in. Okay. Okay, people. Okay, okay. Adding some more people. Okay. And then getting back to my screen, that's the dynamic duo of the individual market here in Ohio. I've been with Cornerstone for 20 years, and I do pronounce that name Jeff. And I do get various pronunciations on that. Actually, I'm actually traveling to the world of Jeff and Sean and all that. Next week, I'm going to England. So, so it's all very good. Actually, I'm going to be in Richmond of all places. So if you're a fan of Ted Lasso, I'll be checking out that. Maybe I'll share some pictures with you guys when I get back. So Carla Winfrey, she's our specialist extraordinaire. She does all things related to service and planning and putting together some marketing materials with her. And this is a very busy time of the year for us as well. We shall be creating hospital lists and carrier lists and all the things you expect from us. And we'll be getting those out to you in the coming weeks as we learn what all the information is. And with that, I am going to stop sharing. And Jason, I'd like for you to share your screen.
Perfect. I'm more than happy to do that. So let's go ahead and get that queued up. Let me know if it's coming through accordingly.
Okay. And maybe you can share a little background.
Yeah, of course.
Any pronounce your last name?
Yeah, it's Madrak. So Madrak, Jason Madrak. I am the head of sales here for Antidote Health. That is a Polish name. A lot of people, if it doesn't end in ski, assume it's not, but it's right in there with Sajak, Novak, Madrak. That AK is
Novak,
that AK is classic. Yes. So,
yeah.
We've got all the trappings every year with our pierogies and golumkis and kielbasas. So we're bona fide Polish over here.
Fantastic. And if you wouldn't mind, could you click on that little wine glass thing again? Or I'm trying to blow that up a little bit. Okay, I think that's much better. Good. Okay, take it away, Jason.
All right, thanks, guys. Jeff, thank you very much for the opportunity to come in and present today. I really appreciate it. As Jeff mentioned, we did get started in 2024, really geared things up for 2025, and now super excited for 2026. Cornerstone has been a fantastic partner for us, so cannot thank the organization enough for helping out the new kid on the block. We'll talk a little bit more about our sort of origin story, get into some plan details. But again, my name is Jason. You'll get my full contact information at the end. I live here in Connecticut, so a little bit outside of the footprint of Arizona and Ohio, which we have, but certainly have spent, and you can ask my wife this, a lot of time in both states over the past couple months, just making sure that we're getting the word out around Antidote. We're going to have a really quick agenda here. I'm going to move a little quickly. All the information that I talk about, and we'll provide the links at the end, is available in much greater detail on our website. But I'm going to just give you, again, sort of a quick overview. If you want to double click and really dive into some things, you can certainly do that. And we'll provide all the links at the back end to help you do that. Quick introduction, a little bit about our background. Our plans are a little different. We'll go into some detail about that. Just to say this up front, because sometimes there's a little bit of a misnomer or maybe confusion. We are a traditional HMO plan. We have a really robust network. We have all of the same sort of product structures and benefit structures, if you will, as many of our competitors. We just offer something a little bit different that we put on top, which for many folks can offer a huge amount of value and convenience. And we'll talk a little bit about that too. We'll get into the boring stuff a little bit later, but up front, just kind of want to get you guys familiar and excited about some of the stuff that we bring to the table. For 2026, we'll talk about our current network. You'll see our footprint. We'll go through some of the other benefits that we offer, and then we can round things out just with a little bit more information around key dates, links, and if there's questions, we can field as many as we might have. So let's get to know Antidote. Again, we are new to the insurance market. We are not a new company. We've been around for, geez, almost 7, 8 years at this point in time. We had a group of folks come together with a kind of diverse background. Some folks that knew about health insurance, a clinical background as well, and then importantly, I think certainly for today's day and age, a tech background. So got stood up about 7 years ago as a telehealth provider, launched that service in 21 states. That service is still available, and we provide that as a standalone practice. But as we started to interact with all these people, and we're talking hundreds of thousands of folks, it became clear that we were gathering quite a bit of information, really helping folks. And it seemed a little silly to just stop at that moment, treating people for, maybe more episodic conditions or issues. And maybe we had an opportunity to turn this into a full-blown health plan. And that's exactly what we did. So we went out, managed to get backing and launched Antidote Health, which is a pay-vider model. Again, the payer and the provider are kind of aligned, and making sure that we're putting our members first to make sure that folks are getting the best possible outcome at the best possible cost. Our mission, people put mission statements up all the time. I'm sure there's some eye rolls when you do things like this, but I put this up here because it's actually really important. We believe that quality healthcare is a basic human right, and we strive to attain a world in which every human being has access to affordable, quality healthcare. It sounds simple, words that are probably used in other folks' statements, but I just put this up here because it does drive everything about our company. It drives who we hire, the kind of people that are attracted to go ahead and join a startup company like ours. It attracts folks that want to design products that might be a little bit different and sort of change the landscape. It drives the way that we handle our customer service operations, our broker service operations. So we take this seriously. And for all of our all-team calls that we have every month with the entire organization, we start out with this statement. So just wanted to share that with you to give you a little sense for kind of where we're coming from. Let's talk about it a little bit around where we're coming from. So last year, our first major year entering into on-exchange business during ACA open enrollment. We added about 7,000 members during the course of that period. So for those of you who got appointed and helped us enroll, we really appreciate your business and we thank you. And we don't take it lightly that it's always a little bit difficult or maybe a little scary when you enroll members in a plan that's new. You're not sure what to expect. The expectation hopefully has exceeded what you might have thought. We'll talk about that in just a second, but we really thank you for the opportunity to service your clients over the past year. We are expecting some pretty substantial growth this year. I'll say this sentence maybe 3, maybe 4 times, depends on how far we go. But I think we are poised to be, based on at least what we were seeing with some of the rate filings, the number 1 or number 2 bronze or silver plan in almost every county we do business in Ohio. So the value prop should be exceptionally strong for folks. And with that kind of growth, we're hoping, not hoping, we're actually gearing up to be able to have more customer service staff on board, making sure that we're gearing up to have more claims processors on board, broker support resources on board. And so making sure that as we grow, we're growing the organization to be able to serve everybody that touches the plan, whether that be member, whether that be a broker, or whether that be somebody on the clinical side. We monitor our member experiences diligently. We are tracking this on a hourly, daily, weekly, monthly basis, looking at how people are interacting with their telehealth visits, how are they using the application, which is a real sort of cornerstone, no pun intended, for how folks engage with us, taking a look at any sort of customer support calls that we have, what can we glean from that, and really taking that information and using it very seriously to continue to inform what we offer. And then we've made some, decision based on those learnings. We've introduced a brand new provider lookup tool, which I think is pretty much best in class based on my own history and experience. We have developed some brand new behavioral health models, given the importance of that in terms of healthcare at this point in time. And then it's continuing to shape all that knowledge, continuing to shape what we're offering as we move ahead. I put this up here just briefly, again, in terms of the way that we treat and monitor customer service and customer satisfaction. We take this extremely seriously. If you've got the folks who maybe delve in this space, we do track something called the NPS score. It's a net promoter score, and it's an industry-wide, actually consumer-wide. Everybody uses this from McDonald's all the way to cable companies, health insurers, you name it. And it's a score which is indicative of how likely you would be to recommend a product or service to a family or friend. And so our number comes in based on this particular system at 66.7. Now that might not mean anything to a lot of folks, but this is really a best in class within the health insurance space in terms of an NPS score. And for those of you who might have interactions with other carriers, other reps, I would encourage you to ask them what their score is. If it is close to this, then they must be doing a really good job. But a lot of companies do not like to talk about this publicly. We're very proud of this. And I mentioned this just because of those folks out there who decided to place business with us last year. This is a good indicator that the experience that they've had with us has been excellent. We also track a CSAT score. I won't go into that, but if you're a data nerd, that score comes in at 76.9. So what makes us different? Well, there's sort of three tenets that we sort of realized right off the bat that we're really limiting folks' ability to get the best possible care, have the best adherence to care regimens right off the bat. Excuse me. The first is limited geography. So as we all know, we can only walk, drive, or fly so far for treatment. And so we're really limited by geography in terms of our ability to go and consume or interact with our healthcare environment. The second one was virtual care equals one-time care. Every carrier out there, and we've been at several events, more than several, over the past couple months. Every carrier has got a virtual care component. That's table stakes at this point. And even Amazon, is advertising heavily their own virtual care capabilities as not even a healthcare company, just as someone playing in that space. The thing about virtual care traditionally, it's episodic. You got something that you need taken care of. You got pink eye. You call up. They call a prescription. And it's one and done. That is a missed opportunity to not be able to use that platform in a more meaningful way, which is really one of the things that we are really focused on. And then the last one, silos of health data. No one's probably fascinated by that being one of the key experiences. We all go to multiple folks. We've got a PCP, we've got a specialist, we've got a prescription from someone over here, we got an eye doctor. All that stuff just kind of sits in these different silos, and so it's really hard to get a holistic view of the patient and be able to treat people holistically when all that information is kind of all hanging out in different spaces. And so we think we're bringing a different model to the table. And this is aside from EMRs. Electronic medical records have been wonderful in terms of starting to corral this. We think there's a little bit farther to go, and we think that we can be that partner that's going to help bridge that. So again, we have that traditional HMO platform. We have all the same benefit grids. We have all the same site types of formularies. We'll provide links to all of those. The one thing that we offer on top of that is what we're going to talk about here. And the first is this virtual care experience. So we have a proprietary group of doctors. They are actually employed by Antidote that you can see at any point in time. They are always available 24/7 whenever you might need care. You wake up in the middle of the night, you wake up or you're at work in the afternoon, or you're having dinner with your family. You can call at any point in time and speak to one of our employed virtual doctors. We also assign everybody who signs up for a plan with us with a virtual PCP, and that's something that they can have a one-on-one relationship with. They can schedule appointments with. They can choose to talk to at their convenience. That is not a substitute for any sort of brick or mortar specialist, or I'm sorry, PCP that folks might engage with. This is just something that we give you access to just by signing up for the plan. If you go ahead and choose to use it like a regular plan, that's fine. But you're also going to have this individual that you can schedule time with to help coordinate things as a PCP. You can use this for just regular routine care. Could be chronic care management, could be something urgent that pops up. But this is an individual that you can go ahead and have a relationship with. Our virtual PCPs have access to a full slate of medical records. So as you use the plan, this individual will be able to sit on top of that and have access to this information so that when you call, they're not flying blind. You're not going to have to waste time getting them up to speed on all the things that just happened. They're already going to have it. Again, trying to break down those silos of data. And if you do need to talk to someone, again, you can schedule time with that virtual PCP, but you can also talk to anybody as part of our network, typically in less than 20 minutes. I think right now we're tracking about 12 minutes. So if you need something, you can talk to somebody very quickly right off the bat. So what does this mean for the members? This is pretty cut and dry, but access, again, you don't have to wait at all. You can get healthcare when you need it on your own schedule, whenever you want it. We are here waiting to take your call. Lower costs, we'll get into the meat and bones around this in just a second, but it's free. There's no copay. Anytime that you call us to see us in a virtual capacity, that could be if you want to call us every day. I hope you don't, because that sounds like something terrible, but if you had to, it would be free each and every time you called us if you called us 365 times a year. Convenience, again, you don't have to go wait in the doctor's room. I always joke, if I'm sick, I don't want to go sit in a room with a bunch of sick people. I'd much rather be able to do this from the comfort of my own home. This is extremely valuable for folks with kids that don't need to, take time off from work, put kids in car seats, get them to the doctor, corral them while you're waiting for an hour. You can talk to a doctor in less than 20 minutes right through the app in the comfort of your own home. And then outcomes, we'll talk about this in just a few more minutes. But the fact that it's convenient and certainly is free of charge, we're seeing people with much more adherence to care management programs, to any sort of care program, because you don't have to constantly go back to an office, take time out from work. You're doing it from the comfort of your own home. And it's just easier for folks, and that means that they're more likely to go ahead and adhere to that care plan. More than just virtual care, again, I can't stress this enough because there have been some misconceptions. Traditional HMO, you can go ahead and use this any way that you would like, which would be just like you'd experience with any of our competitors. But when you do go virtual, there are these cost-saving benefits. So as I just mentioned, virtual care, always free. In-person care, if you do get a referral to someone in person, meaning you call and they say, hey, this looks actually more serious than we thought, or yeah, you probably should have some other things checked out. If you start virtual, that visit in person will also have a copay wage. So just one of the benefits of starting virtually. And then this blended care concept, If you do ultimately start virtual, but need to go to specialist, there might be something, again, that's more serious that can't be diagnosed through that initial process. You can also get either $0 copays or significantly reduced copays if you start virtually first. This next slide is probably the most important slide in the deck, and this is going to give you a quick example of what I'm talking about in terms of virtual first. I'm actually going to go in reverse order. My marketing team has not had a chance yet to go ahead and flip this around. Number three is kind of the traditional approach. Again, to certainly I am. Hopefully, most folks on the phone are used to using our health plans. Number one's the happy path, and then number two is kind of what I was referring to with that blended path. So let's just take a couple minutes and kind of focus on the information here. So in this example, let's say it's 7 o'clock, you wake up and you got some sort of annoying rash on your arm. It's pesky. It's something that you certainly don't want to spend days living with, and so you need to go ahead. But you got to leave. You got to leave for work in like an hour. So you got a limited amount of time. Let's start with number three in terms of again how the plan can be used. So in this particular example, you wake up, you call your doctor. Makes perfect sense. They probably can't see you today. They might be able to get you in the next day, maybe 2 days. Let's say in this case, it's 2 days. You go ahead, you get in there. It's a $0 copay. You always get four $0 primary care visits free of charge. That's basically one a quarter as part of our plan. So right away, you're already saving money. We're trying to remove barriers to care. You're going to take one of those four and go see that PCP. In this example, they take a look at it in person and say, yeah, there's something weird going on. You're probably going to have to go see a specialist. So now you got to go to a dermatologist, notoriously hard to get appointments with. So that's probably another week out. And in that case, you're going to have to pay the full copay, the full specialist copay, which in this case is going to be $100. And then he's probably going to give you a prescription. Let's just say it's a generic. And so that's a $35 copay for that prescription. So in this example, you're about a week and a half out, $135 out of pocket. But you finally got the treatment you needed. And I think, again, for most folks, this is kind of how things typically work. Let's go up to example number one, and let's talk about this sort of happy path, if you will. So in this case, same thing, wake up, nasty rash. You go through your app, you book an appointment with a virtual PCP. It typically happens, again, we're averaging about 12, but let's say it starts in 15 minutes. They take a look at it. They can pretty much diagnose exactly what this is. Again, it's always free to call your PCP. Because you started virtual first, you're going to get a $0 prescription because you started virtually, and they're going to call in the cream, probably the same cream that you would have gotten in number three. And this time it's free, again, because you decided to go virtual first. So you've got the care you need, you've got no money out of pocket, and you're done in pretty much an hour and managed to get to work on time with everything that you need. The second example here is that sort of blended process I mentioned earlier. So same thing, rash, call, PCP, 15 minutes. It's always free if you go virtual. They give you a referral, just like before. This is something that we're not comfortable giving you a full diagnosis over the phone. You should probably go see a specialist. You still got to wait that week. But in this example, again, because you went virtual first, that copay goes from 100 down to 40 because it's reduced. Ultimately, again, now that you're at the doctor, that specialist is going to give you a prescription that's going to come in at $35. Now that's only $75. So you can see in this example the benefits of going virtual first. If you use traditional 135, you're about a week and a half out. I would encourage you to go look at anybody else's benefit grids, whether that's United, Ambetter, the Oscar. You're probably going to end up in pretty much the same spot. Happy path, 0-0, you're done in an hour. And that sort of blended path, you're still better off from an out-of-pocket perspective, and you've sliced that time down by about a week. So this is a stylized example, but just to give you some perspective on how best to use the plan and how it can really benefit and save members time, which is excessively valuable, and hard money. So here's our service areas. We'll focus on Ohio for those who might dabble over in Arizona. We were in Maricopa and Pima County last year. This year we've gone ahead and added Pinal County. Those three counties alone probably make up about 90% of the population in Arizona. It gets rural very, very fast, but the majority of the major population centers are in those particular areas. For Ohio, similar map. You'll see our existing footprint last year, which is in dark blue. We did add in a couple of additional counties this year, which you'll see in the light blue. I tend to think of them maybe as collar counties or counties that sort of surround some of the larger population centers, but we're always looking to expand each and every year. So this will be the footprint coming up. Not to belabor a point because I think you probably all know this. Obviously, ACA individual plans, Arizona, Ohio. We do offer a small group offering in Arizona for those who might play in that space. And then we do have off exchange plans in Arizona and Ohio, obviously trying to address needs for the ICHRA market. So we are very active in that space. If there are folks who want to explore ICHRA a little bit more, whether that's just learning about what that crazy acronym means, whether it's trying to kind of delve in and find out what kind of benefit packages work best, please don't hesitate to call or reach out. I know Cornerstone themselves have fantastic resources around understanding and going after ICHRA business. I think that you'll find that a Antidote solution is an excellent fit for several potential customers. But yeah, always happy. Please reach out to Cornerstone. Please reach out to me directly if this is something that might be of interest to you.
Amen to that.
Yeah. Thanks, Jeff. Very quickly, just basic plan features. We talked about this $0 tier 1 PCP visits. You get 4 of those a year, basically, again, 1 a quarter. We do have options that are going to include dental. I'll talk about that in just a minute. And specifically for Ohio, PT, OT, and Chiro benefits are at parity with those PCP visits, meaning that you're going to get a free visit if you want to use one of those 4 for any of those particular services. When you go virtual first, again, we've got the same traditional HMO product in place, but if you decide to use this virtual component, unlimited $0 visits, you also get an additional maternity benefit, $0 OB visits if you're referred to by an Antidote virtual provider. So again, go first, you get that $0 OB visit, and then $0 copay for generic drugs, or as we just talked about in that prior slide, a reduced copay when prescribed by an Antidote virtual provider, and then reduced copays, just like in that example, when you're referred to by an Antidote virtual provider. Our plans, not complicated. I've seen some plan grids that have about 30, 50 names. We've got 2, so it should be pretty easy to remember. Complete and Elite. And for each of those, that's across metal tiers. You can also go ahead and add on a dental product if you'd like. The sort of differentiation here kind of comes down to the formulary. So a 2-tiered formulary, the core RX, if you do go with the complete plan, $0 copays on all of those drugs in those tiers. If you do ladder up and go to the Elite plan, it's 0 core and also 0 on the advanced RX. And then there's a slight lab benefit. You get a $0 copay for labs if you do start with that virtual provider first. Here's our network in Arizona. Just give you a second to take a look at that. We are in conversations constantly with provider groups and hospital systems in Arizona and Ohio. So this list will change. We might get folks on off cycle, but we are always constantly trying to make sure that we grow our network. We've got a team of people that really look at that as their primary focus. And then for Ohio, here is the group that we have coming up as of 2026. We're happy to be able to add in university hospitals, also added in Kettering Health. Jeff, you sent along a list as well. Uh, our network contract guru, Chris Jaquet, has gone through that. I don't think we had any changes. It was confirmed, but I'll send an additional note that you could share with the team just to make sure that that's buttoned up.
Okay. Um, Good. I did want to call out Ohio State there and Nationwide. That's massive. And then adding Kettering, so you've got a really good partner in the Miami Valley, Dayton area.
Perfect. Perfect. Love to hear that. Chronic conditions, I'm not going to belabor this too much. There's two examples here, diabetes, hypertension. There's obviously several more, but there's a theme here in terms of how Antidote helps folks with chronic conditions. So again, the first one, virtual $0 PCP visits. If you do suffer from diabetes, uh, you can reduce the amount of time that you have to constantly go in for checkups to the doctor, and also have a copay for those by just going and utilizing a virtual coach. So for Antidote, if you do suffer from a chronic condition, we will give you a dedicated person that will be there for you. We'll know your condition, we'll know your history, and set up really a very customized, personalized approach for you to manage and deal with that chronic condition. So that could be a lifestyle assessment. It could be looking at diet and exercise, and getting a plan in place to make sure that in the case of diabetes, that your blood sugar levels improve. Uh, like we mentioned earlier, if you do need referrals, those are discounted because you started virtual first. And then we do have $0 on select insulin and other related supplies for those of you who might have clients that do have diabetes. We can provide that list. But this is a chance to offer folks, again, very convenient, customized program, substantial cost savings overall, as opposed to going through the traditional brick and mortar model. And this same thing applies whether it's hypertension or other sort of conditions that folks might have. We're also offering a no-cost weight loss program this year. I keep joking that my wife is encouraging me to enroll in this, so I'll let you know how it goes. We did pilot this in 2025. We've gotten great feedback. I will say that this is not a GLP-1 oriented weight loss program. This is going to be much more traditional in terms of diet exercise. I know that that sounds a little less exciting, but we've seen people have great success. And when I say great success, I mean taking the weight off, and because it is lifestyle focused, keeping it off, which is I think the key thing that all of us are looking for. So just like with any of the chronic care programs, we believe very strongly in this. It is dedicated, one-on-one coaching and care, and you can make sure that this individual is someone you have a relationship with to set goals, and get you over the finish line in the best possible way.
Jason, can I jump in with a question?
Yeah, of course.
Hallie asks, will all locations with university hospitals, that's up in Cleveland, will
Mhm.
they all be in network?
They will all be in network.
Great. Thank you.
Yep. Yep. That was a good question and an easy answer.
Mhm.
Dental, teeth are part of the body. We do offer the ability to put a dental benefit on top of this. The benefit we have offers about 1,400 or 140,000, sorry, dentists across the country, operating out of about 4,000 offices. It's 100% preventative care. Those are those two lovely cleanings that we all get each year. And then it does have a 50% coinsurance for basic and some major services. That's going to be your caps, your crowns, your bridges, etc. But again, this benefit is probably similar to what you'll see from other competitors, but just wanted to make sure that folks know we completely have a dental benefit that you can add on, if that's of value. And then all of our plans per ACA do have that pediatric dental benefit as well. Pharmacy benefit, we are anchored in Walgreens, which is obviously nationwide. Outside of that, we do have a whole myriad of independent pharmacies, both in Ohio, Arizona, and nationwide as well. You can get a prescription outside the service area if it's called in. For example, if you are going to Florida, need to get a prescription called in, you can get to Florida, and you can get those medications called in, pick them up there. There's no barrier in that sense. For those folks who might be familiar with GoodRx, this traditionally is a individually downloaded app that helps to make sure that you're getting the best possible price for prescriptions you might have. This is actually already just baked into the apps. It's actually baked into the member portal, so you don't have to pay any sort of additional fee or have an additional app. This is already baked in. Um, SSO, single sign-on, when you do go to your member portal, you can download and take a look at a myriad of different medical, or I'm sorry, formulary information, whether it's cost, history, find a pharmacy if you're traveling, etc. And then also we do offer mail order medications, and then a discount if you do get a 90-day supply. I'm not sure that that's really a huge differentiator, but just wanted to guys make sure you guys knew that that's something that we have that is really on par with other folks as well. The drug list, won't spend a ton of time here. Like we talked about, that $0 core RX, you get that with those complete plans. If you do ladder up to elite, you get $0 on that on that second tier formulary. We've added a bunch this year, so we've got 20 new high blood pressure medications, continuing to expand our diabetes treatment options. We've added a series of new antidepressants. This list gets updated throughout the year. So our team is always trying to make sure that we've got the best, the most effective, the most recent drugs that are available for a myriad of conditions. So if you do have members, there could be notes throughout the year regarding new coverage options for specific medications. Just briefly, the member portal. I put this up here really just for sort of one point. I've personally worked at several carriers over my way too long history working in health insurance, and a lot of times, especially for the member, you're dealing with these portals, these member portals that are built on legacy systems. They were designed 20 years ago. They've got a bunch of patches that have been thrown on to sort of get them up to speed. Things have been bolted on the back end. They're pulling in data from all sorts of antiquated systems. It can be a real struggle to go ahead and make them work. Our technology and our platforms and apps are brand new. So they have been built specifically for the way that we consume and utilize information today. Uh, all the best technology, all the best research and know-how in terms of how folks like you and I actually interact online, where our eyes go, how we click on things, what do we need to get to first. And so this is really built from the ground up and is current as of today. There are no updates, there are no patches. This is brand new. And so we've experienced some really great feedback in terms of folks saying, man, it was intuitive. I could go on. I found it exactly what I needed within 2 seconds. I didn't have to click through 10 menu options. It's literally right here. And so this is how you use the product. Which is through the portal. So scheduling visits, medical records, you can pay your bill right through here, which is important. You get your ID card visible through here. You don't have to keep that piece of plastic buried in your wallet or purse. You can go ahead and find any sort of provider that you need to find. Tracking deductibles. We talked about prescriptions. It's all right here. It's very intuitive. And we're actually quite proud of the fact that we've got really, again, best in class member portal for folks to use. Our member support, I put this up here again. I think it's important, 8 to 8 p.m. Eastern. So some pretty expansive hours for folks to be able to call. I will tell you this is that all of our member service representatives live right here in the United States. So they're all domestic stateside. You can call, email. We even have a chat support function to engage with our member support team. And we spend a ton of time making sure that we train our agents on every aspect of the plan. And the goal of this, first call resolution, plain and simple. We want to make sure we'd love to hear from our members, but we want to make sure if they've got an issue or have something they need help with, you should not have to call us back 3 or 4 times. Call us once. We're going to make sure that we solve your issue right off the bat, save you the time, and get you on your way. So that's why we spend the time that we do training folks. We measure all those member satisfaction scores that I talked about earlier. If anything is causing those numbers to dip, we get on it real fast with the plan. If there's anything that causes those numbers to rise, we get on that too to make sure that we do more of it. So it cuts both ways, but we monitor that constantly. And then something just a little unique, maybe a little esoteric, 24/7 tech support. A lot of times when folks are calling into customer support, it's not a clinical issue. It's something where they couldn't find something maybe in the app or online. Maybe they've got to refresh their cache or history because the app is functioning weird. Maybe they're on an outdated system. You can call us and go through those issues 24/7. So if it's not clinical and you don't have a question about your plan, there's just something going wrong IT wise, you can always call us and we will go ahead and take you through that. And I'm not going to lie, I've actually used that twice. So working with us, partnering with us, we got broker support here for you. Again, that's in person, and that's 8 a.m. to midnight Eastern time. I'm hoping that no one's calling us at 11:45 on a Friday. But if you did, we are open until midnight. Same exact thing here. Our broker support team is completely located here stateside in the United States. We have a very active broker portal that was literally just updated. So if folks who have enrolled business maybe haven't logged in recently, there are going to be some changes. Happy to get on the phone and do a quick demo for folks around some of those new features. But you should be able to see your full book of business in there as well. For those folks who might need administrative access, I'm probably talking to a very small group at this point. Commission statements are posted in there as well, and we can make sure that folks have access to be able to review that. All of our branding materials, our co-branded materials, they should be up there literally, maybe even as I'm speaking or tomorrow. You can get access to that full breadth and scope of materials through that broker portal if you choose to do so. And then also any sort of plan documents, et cetera, all the detailed benefit grids, et cetera, those will all be placed in the portal for you to have access to as well. If you choose to, once you're in the portal, you can have a direct link to be able to enroll folks in Antidote plans through Health Sherpa. I certainly realize that most folks just use Health Sherpa directly to enroll folks, but if you did decide and you were on the portal to go that path, direct link in there. We are also this year listed on Health Sherpa's off exchange portal as well. So as of the beginning of the year, we were not posted there. But if you were quoting off exchange business through Sherpa, you will now see Antidote Health listed there. Again, that's primarily for ICHRA. So if you have questions, certainly, again, Cornerstone is extremely savvy with this. And if you had questions about Antidote specifically, always here to help. We can go through this super quick. What you can do, again, you can go ahead and get a quote. You can enroll people through the portal. All those benefit documents we talked about, flyers, trainings. You can actually see your members' ID cards through the portal. A lot of times I know folks, again, with different tech levels of tech savviness might not be able to go ahead and do that themselves. So you can do that for them. You can also submit payments on their behalf. And I know that that's been a pain point over several enrollment cycles, but the broker or you as the broker can now go ahead and do that. Commissions for this year, they stayed the same. So for both Arizona and Ohio, we were at a $20 PMPM rate in each state. We did not have a renewal commission last year because we did not have anybody to renew, but this year we do, and they will be the same. So it's a $20 whether it's new or renewal. We do have the five member per policy cap. I think that's pretty much standard. But basically, if you have a family of five and they all enrolled, you get a $20 PMPM on every one of those five members. If you had a family of 10, God bless them. That sounds really, really hard, but you would only get commission on the first five of that family of 10. And then for small group, go ahead, Jeff.
And that's for off exchange as well, right?
Correct. Yep.
Okay.
Same on and off.
Okay.
Correct.
Okay.
Thank you. Thank you. And then small group, $25 PMPM if folks are writing that sort of business in Arizona. We will also have a agent level bonus program. That should be announced probably the next couple days. I think all the carriers play a little bit of a game of chicken with who's going to come out with theirs first. But we will 100% have a bonus program in place for agents. I hope that everybody on this call has been appointed. I hope that everybody on this call has renewed their appointments for 2026. I hope that our process is pretty quick. We use Miramar as our broker appointment management tool. There's a couple of other platforms out there, but
Yeah, how are you guys doing with that? Throw something in the question box about the appointment process. I thought that went pretty smoothly. If you're having any issues or any comments you want to make, throw that in the question box. It's good time for feedback.
Perfect. And I appreciate that, Jeff. So, yeah, for folks that are appointed with Cornerstone, and you can reach out to me directly for this too. It's very easy. If you're already appointed, there is a code. You log into Miramar, enter the code. It basically signs you up for next year's plan. You have to go through and just very quickly, this takes all of about 30 seconds. Just say, yep, still in Ohio or still in Arizona. It goes ahead and reruns a license and background check, and you're pretty much good to go. So that the recertification process, super easy. For those who might be coming on board for the first time, same thing. There is a code for new agents coming in through Cornerstone. You put that in there. There's a couple of additional check boxes, an agreement, code of conduct. You pick your states. Again, that takes all about 30 seconds. You submit it. We run the background and licensing check, and then you're good to go as well. So if anybody has any questions about that, certainly you can reach out to Jeff, but you can always call or email me directly if there's any sort of issue. Again, it tends to move pretty quickly, but obviously there can always be something that might be a little snafu. But we want everybody on this call certified and appointed to sell Antidote. Additional information, again, you guys know this stuff just as well as anybody else. The enrollment period this year, I think, thank God, was kept the same. There was talk about shortening it. Some people were trying to elongate it. It ended up being just the same as it was every year, November 1st to January 15th. If you get folks in by the 15th of December, they can start the year with coverage. If you get them in during that second window, all the way up to January 15th, they start with 2/1 effective dates. And then we enter the always lovely special enrollment period. For those folks who might actually kind of dabble in SEP business throughout the year, this year is going to be different. I'm sure as most of you know, during COVID, many of the sort of requirements around SEP were just simply suspended under the spirit of trying to make sure that folks had access to insurance, especially with the health needs that came during COVID. All those suspensions have been lifted. And in fact, a lot of the requirements regarding documentation have come back in a really big way. So if you are going to be enrolling folks during SEP, I just encourage you to make sure that you've got any sort of documentation lined up, buttoned up, and ready for submission, because it's going to be much more challenging to get SEP enrollments through the door if there are any sort of gaps or just questionable documentation.
and talk to me. So
Yes.
we're gonna be right here. There have been a few pullbacks on the implementation of that. Some of the stuff's been paused a little bit. So give me a call if you run any issues. And again, it's all baked into the Health Sherpa process. So you don't need to be an expert on all this regulation, or for that matter, generating quotes and all that kind of thing. Sherpa does it for you. Okay, it's a step-by-step process, and that's the beauty of that. Just know the content of the carrier, and you should be good to go. Um, I did I do have a new question for you,
Sure, of
Jason.
course.
You ready for a
Yeah.
question?
Yeah.
Is Antidote a good member? I'm sorry. Is Antidote good for a member who has major surgery pending or monthly infusions?
So I'll give you two answers to that. If you've got major surgery, you can sign up with any carrier. And so if we are in network, if we've got the doctor that you need, if there's an anticipation of some sort of treatment option on the back end, please take a look at those. And if that works for your member at the price point that we're coming in, then welcome to the Antidote family. Again, those would be just a couple of things I would look at. But we are here to provide, again, high quality health insurance. If we are the plan that provides and checks those boxes, please come on board. We are happy to have you. The second part of that question, Jeff, could you repeat that?
Okay, well, who has major surgery pending or monthly infusions?
Oh yeah, monthly infusions. So infusions, if you want to send me the individual's name who asked that question, I can reply directly. This one gets a little bit tricky, and I'm not a clinician, so that's why I'm not going to answer right now. There are a couple things that happens with infusions. It's the drug itself, and then it's how it's infused, and then even worse, it's where it's infused. So there's this sort of trifecta of things that make covering or speaking to that benefit challenging. And so I don't want to say something out of turn, but it's those three issues. So if there's a particular case, happy to talk offline because it gets a little bit tricky, and I don't want to say anything that I'm not 100% sure about.
And getting back to the provider listing, where would a broker find Antidote providers?
So that's a great question. So maybe we just go right here, and I'll send this presentation around. If you do want to take a look at our provider directory, you can see that there. It's the third from the bottom under medical providers. Again, it's up to date. It was just refreshed, so you should be able to get what you need there. You can take a look at our formulary, all the broker information that I just talked about for this coming plan year. And then you'll see my individual contact up there, my email, that's my cell phone number. You can call me anytime, as well as broker support and member support. So all the information, again, I didn't want to take today to dive too deep in there. But if you do, it's set up in a pretty traditional benefit grid. And you can find that data there. And then the provider group, please go in there and search.
Can we get a copy of this deck? Can you send that out in
Yeah, I will
follow-up?
send it as soon as we
Okay.
as soon as we get off the phone.
Okay, that's great. Let's see if we get any more questions. Um, okay, guys, we're at about the hour. Give it a few more seconds, see if there's any more questions.
Okay.
Great participation, everybody. I realize today is the first day of AEP, but we had a nice number of folks on the call, and we're so delighted that Jason could join us today. So I think that's going to be it. Jason, any final thoughts?
No, again, for those folks who took a chance and joined us last year, thank you so much. We've got a great suite of products, an amazing price point for this year. Hopefully what we talked about today gives you some confidence to say the folks that did jump into the pool last year had a great experience, and would love nothing more than to have other folks here on the phone get appointed, come to the Antidote family and start to enroll. So hopefully we'll all collectively have an amazing OEP selling season.
Great. Thank you so much, Jason. Everybody
All
have a
right.
great day.
Awesome. Appreciate it, everybody. Thank you.
Thank you.